alaikum wa rahmatullahi wa barakatuh. I would like first to start thanking Dentistco for inviting me and giving me this opportunity to talk about the clear aligners. Now, to start with, there are many different brands for clear aligner, and sometimes the abbreviation is CAT, C-A-T. CAT stands for Clear Aligner Techniques or Clear Aligner Treatment. Now, as I said, there are different brands, but because the thing or the brand that I use is Invisalign, so whenever I talk about it, I'm referring to Invisalign. Now, before I go further into the details and the advantage and disadvantage of Invisalign, I would like to talk about what are the different approach to start the treatment. Now, basically there are different techniques, and I'll show it to you now. The first one, which we all know about, is the metal braces. These are the braces that we bond to the teeth, and it's made of stainless steel and some nickel and titanium. And then the wire, which is a different type of wires, nickel titanium wires or stainless steel wires or TMA wires. And sometimes if the patient don't like these metal braces, we can do ceramic braces. Ceramic, we bond it to the teeth, it's not visible, but then the O ties, the one that we secure it with, is also transparent, but the problem is that after like first week it turns into yellow. And the wire, this is only in the picture, it looks white, and we have white wires which is not shown, but as we go along into the treatment, we should have a stainless steel wires and TMA wires, so usually the wire is into a stainless steel. The third technique for treatment, for orthodontic treatment, is the lingual braces. It's something that's customized to the patient teeth. We take an impression, we send it to the company who make this, and then we have the lingual braces. Okay. The fourth one, which I will talk about, is the Invisalign. And Invisalign, when it started, it was in 1997, but then it became available for the orthodontist in 1999. So it's almost like 19 years in practice. Now, Invisalign is not something new. It started in 1945 by Dr. Kessling. Dr. Kessling, what he said is that like after you're done with the metal braces and you're still not finished yet, you can make a positioner. So basically you take upper lower impressions, you pour it, and then you reset the teeth. You section the teeth, you move them into where you want them to be, and then you make a positioner. And that was in 1945. But then in 1971 or 72, another doctor made same attempt to make an Invisalign, and what they do, they take an impression, pour it, reset the teeth, so he will move the tooth maybe half millimeter forward, and then he will make a clear retainer or suck down retainer, give it to the patient. 3 to 4 weeks, patient comes back, you take another impression and you pour it, you reset the teeth, you move the teeth another half milli or another a quarter of a milli, and then you take another impression, and so on. But this is a time consuming. In 1997, Invisalign was started, and Invisalign, the one who did Invisalign is a computer engineer, and I think the story behind it is that he had braces and it bothered him, and he was talking to his doctor that what if we do something that it's like clear, and can we do it? And the doctor said yes, we can do it. So the idea behind it is that we take the impressions and then we scan it, and instead of having a study model, we will have a virtual study model. And in that virtual study model, you move the teeth, you set them where you want them to be, and then they will like you want to move the tooth 1/4 of a milli, and then you move it again for 1/4 of a milli, and then you move the tooth 1/4 of a milli until you're done. And let's say you had like 20 movement. So when you have this 20 movement, that means you can have 20 stage. The computer will do it for you. So that the idea behind the braces. Now, what is the advantage of Invisalign? Now, aesthetic. As you can see here, it's clear. Sometimes, like if you look carefully into the patient's teeth, you can notice the Invisalign, but most of the time, people don't notice it. Aesthetic is the main advantage of Invisalign. It's not shown. You can take it out when you are like in a meeting, or you're in a special social gathering. You can take it off. When you're done, you put it on. So aesthetic is the one of the biggest advantage of Invisalign. Now, what's the other one? Cleanness. It's clean. You take the Invisalign off, you brush your teeth as you usually do with a toothbrush, and it's a big advantage that you can floss, and then you put it back on. And also, in terms of cleanness, you're only wearing the Invisalign for like 10 to 14 days. So after that, you can throw it and wear a new one. So it's like clean braces, or like clean aligners in your mouth. Unlike braces, once you bond the braces into the teeth, it will stay until the end of the treatment, maybe 1.5 to 2 years. Also, one of the advantages is less emergency visit. Sometimes braces and the wires, it breaks, and then the patient comes back, you rebond the bracket again. Sometimes a wire start poking the patient or irritating the patient mucosa. So with Invisalign, it's much less irritation, and usually there is no emergency visit unless the patient loses his aligner. Also, one of the advantages of Invisalign is that it's intermittent forces. There is no continuous forces for like braces. When we tie the braces, it's tied in the patient until he comes back to us 4 to 6 weeks later. But like with Invisalign, the patient takes it off during eating and he puts it back on. So there is like intermittent forces, and usually it's not like continuous or severe or continuous pain throughout the treatment. Also, the flexibility of mastication, there is no restriction with metal braces. We ask the patient to avoid hard food and sticky food because it may break the braces, and sticky food may stick to the braces, and then it's going to be difficult to be removed. With Invisalign, there is no limitation. There is no restriction on diet. Now, one of the also advantage of Invisalign, sometimes with metal braces, after we put the braces in the patient's teeth, we ask him to come after a month or a month and a half. But there are some patients who just disappear, and they come back after like 4 months, 6 months, Some patients, they come like after 1 year. So this is really risky because teeth may move into unwanted direction. Sometimes because we tighten the braces, we're expecting the patient to come after 4 to 6 weeks, but if he doesn't come back, the tooth will still continue in the movement, and sometimes it may go into a wrong direction. With Invisalign, the amount of movement, it's controlled. We know that teeth will not go any further because we only give the patient number of aligners. After he's done, he will come back to us. And one of the advantage also of Invisalign is that we can control the movement. If I want a certain tooth to move, like here, this is one of the cases. So if sometimes I want a certain tooth to move, okay, I'll show you a case here. This patient came with spaces. So see how his teeth are moving, but then at the end, I only wanted this tooth to move, okay? So here. In the last movement here, like here, I don't want the posterior teeth to move, only the front teeth. So you see, I can control what are the teeth that will move, okay? So this is one of them of Invisalign. Also, one of the advantage of Invisalign is that the use of elastics. Sometimes we give the patient rubber bands. We want them to start using the rubber bands. With metal braces, we cannot use rubber bands اللي هي المطاطات until we reach a stainless steel wire. With Invisalign, like another case, I have this patient here, and as you can see, if you look at the occlusion, patient into a class 3. This is the cusp tip. It should be here in the mesobuccal groove of the lower first molar, and you see the cusp tip of the canine is here. And this is one of the cases that you really want to be very careful when you start this patient in braces, because if you just put metal braces here and then you put a 14-9 tie wire, the teeth will move forward and patient will turn into a crossbite, anterior crossbite. But from day one, from aligner number 1, I started the patient with elastics. Here there is a hook where you see the blue line here, and there is a lingual button, or like this, like a bracket over here. It's at the back, it's not visible. And I gave the patient class 3 elastics. Class 3 elastics because it starts from the lower canine to the upper first molar. Class 2 elastics, on the other hand, is when you start from upper canine to lower 6, but this is class 3 elastics because this from lower anterior to upper posterior, and because we want to move lower teeth backward. Now if you see, as we go into the treatment, the upper teeth go forward, lower teeth goes backward. Yes. Okay. So this is one of the advantage of Invisalign, that you can start this early. Now, one of the advantage also with Invisalign is that what if your patient comes with upper veneers or upper crowns? Sometimes you cannot do it. So, I mean, you can bond metal braces on the crowns, but the problem with that is that you may roughen the surface of the veneers. So when you're done, patient may need to redo his veneers, or sometimes it needs to be polished, but it's not, you cannot glaze it. With Invisalign, this is one of the good things about Invisalign is that you don't need, no need to redo the veneers after the treatment. Now, these are these are the advantage of Invisalign. Now, what are the disadvantage of Invisalign? Now, the biggest thing that we have is compliance. It's like you're giving all your control to the patient. You design the case, you plan the treatment, and then you give the patient the aligners. But then if the patient does not wear them, it's not gonna go the way we plan to. I try most of the time to avoid treating patient under 18 years of old, unless I have their parents can guarantee and make sure that their kid will not lose the aligner and they will remind him. And I have done a few cases on teenagers, 13 and 14 years of old, but it's not my first choice for them. I usually like to do Invisalign for patients above 18. And even though I still have some issue with very few patients that with their poor compliance, we shifted to metal braces. So compliance is one of the disadvantages. Patients should really wear their retainers and with their aligners, and I told them to wear it at least 20 hours per day. Now, the other problem with Invisalign is that there are some limitations for teeth movement. Most of the time I can do Invisalign for most of my patients, more than I think 80% of the patient. There are cases that are difficult to do when there is a severe rotation. If one of the teeth is rotated, you cannot rotate the tooth more than maybe 30 degrees. Especially if that tooth is a canine. Canine has a long root and a large surface area. Rotation for canine is difficult. Also extrusion, in case the patient has a tooth that needs extrusion, or impacted canines, impacted teeth that you would like to extrude the teeth, you cannot do it with Invisalign. There are different techniques that you can do, some lingual buttons and some rubber bands with Invisalign, but it's not predictable. The last, I think, limitation for Invisalign is that bodily movement of the teeth. And this is sometimes it's confusing to our colleagues or to our patients when we say that we can do Invisalign with extraction cases, but here we have to be careful with it. I have done Invisalign for extraction cases, but I did it, and I'll show you that here. This is our patient. I hope the photo is clear. He has severe crowding in the upper and crowding in the lower. So this is his clean check. This is what I received from Invisalign, and I have extracted the upper fours. Now, I'm not talking about space closure. I will just align the teeth. So after I extract here, watch as I go. After aligner 2, this is aligner 2. Patient will wear it for 10 to 14 days, and then he will go back. You see, I'm moving the teeth, the canines backward, to provide space for the lateral and to provide space for the central. Okay, so as I do this, now the teeth is almost into a better alignment. Okay, look at the extraction space. It's almost now 2 to 3 millimeters. So in such cases I can do Invisalign. But what if the patient came to me like this, with aligned teeth but with protrusion? Sometimes some patients, they come with incompetent lips. They cannot close their lips together, and their teeth are forward, they're protruded, which means if you will extract fours and then close the space, you need to move a bodily movement of the canines all the way to the premolar. So this is what I'm talking about, like extraction. So basically for Invisalign, I do it for most of my cases if the patient would like to go for Invisalign, and for extraction if they have severe crowding. But if they don't have a crowding and just protrusion, then it's difficult to do it for them. Now, the last disadvantage of Invisalign actually is trauma. Now, I have a question here from someone, proclination of one tooth due to a trauma. Now, if a patient has a trauma, there is a risk of root resorption, and we tell the patient that there is a problem if there is like a protrusion, or there is a history of trauma. One of the disadvantages of ortho treatment in general is that root resorption. So we should always make sure that we take periapicals, we make sure there is no problem with the roots, and also an informed consent that root resorption may happen. And it depends on the amount of proclination. Like if it's severe proclination, sometimes I prefer to use metal braces, but I think it's case by case. Let's say a patient who is young, his bone is soft, then maybe I can do it. Patient is like older than 25 years of age, and only has bimax protrusion, then I think it will be difficult to close the spaces. Now, the last disadvantage of Invisalign is cost. It's costly, and the cost is like 50% to 70% more when you compare it to metal braces. There are other brands other than Invisalign, which is cheaper than Invisalign, but for myself, I don't use them. I only use Invisalign because I think the other brands are not good enough as Invisalign. And if it's a simple case, then Invisalign provide an option to use Invisalign i7, which is cheaper than the Invisalign full. In Invisalign, there are 3 categories. Invisalign i7, if you can treat the case in 3 months and a half. Invisalign Lite, if it's not more than 14 aligners, and Invisalign full when it's more than 14 aligners. But basically, I only do Invisalign. Now, with Invisalign, when it started in 1999, most of the orthodontists hated Invisalign. They did not like to use it, and at that time it was primitive. And then after a few years, there was some improvement in the Invisalign. And it's like the iPhone. When the iPhone started as iPhone 3, and then iPhone 4, and then iPhone 5, and 6, and 7, Invisalign has the same thing. It started like generation 1, then generation 2, 3, 4, 5. I think now they are in generation 6. So like after like 2 to 3 years, they come up with an improvement. So I think Invisalign right now has a lot of features and has improved a lot when it's compared to the Invisalign when it started a long time ago. Now, let's show some cases that I have. This is one of the patients came to me with spaces. So this is him, upper spaces, lower spaces, but class 1 right, good over button over jet, nice class 1, but he has spaces. So what I have here for him is I have 27 aligner, which means 27 stage. Basically, it's only to here 24, but I always ask for overcorrection in case when I finish here and patient still have some spaces, then I still can do it. So this is how we started, and we moved his teeth. You see, as you go along, his teeth moves, and here we closed all the spaces. Now, same thing for the lower. He came with the spaces, and with the Invisalign, all the spaces have been closed, and this is how is our patient after the treatment. Now that was the spaces case. Let's see other case. This is simple case. Patient came, had some crowding, did not like your teeth and would like to move it. So basically it was done in 14 aligners. So this is Invisalign Lite, and in 11 aligner I was done with the upper. For her lower teeth there was a crowding here in the lower teeth, so what we have I have to provide the space for the teeth, so I did interproximal reduction, 0.5 millimeter between each tooth. So after I've done it from day one, and then we moved her teeth until we're done with until her teeth were aligned. Now look at from stage number 9 to 14. Look, the movement was only here. So this is one of the advantages of Invisalign, which is the control of teeth movement. You see, it's only one tooth that you move. It's difficult to do it with metal braces. It can be done, but it's not predictable. With Invisalign, you're making sure that these teeth are anchored, they're not moving, and it's only when this tooth that is moving. This open bind case with protrusion or flaring, and this is minor flaring, minor proclination. What we did, IPR lower, and here we have the attachment, and the attachment are in the upper to extrude the teeth. So I extruded the teeth in the upper and IPR in the lower, and that moved the lower teeth backward, and we closed the open bind. This is the case that I showed you earlier, a class 3 case. We started class 3 elastics from day one, and as it goes backward, this is how we finished. And sometimes I overcorrect just in case the patient did not wear his class 3 elastics. I want to make sure that I have solved the anterior crossbite that the patient has. Lastly, this case, this is the case that I showed you. I had an extraction. Now, if you see the photos of the patient, he has class 2 canine, and I did not extract in the lower because he has a class 2, he has a bird face, class 2 profile, severe crowding in the upper and in the lower, moderate crowding in the lower. So what I've done in the lower teeth, I did an IPR, a 0.5 millimeter IPR in all the teeth. Okay, and then I moved the teeth. I tried to avoid extraction because my plan for him is only extraction in the upper. And that's him. Only extraction in the upper. And this is how we started with the patient with a class 2, but I moved the canine backward and I finished full cusp class 2 molar. And it's okay to finish full cusp class 2 molar. Okay, the other side, same thing, class 2 canine, and then we moved his canine backward. So this is some of the cases that I have, and one of the difficult things with Invisalign is that you have to plan the treatment ahead of time. With metal braces, what we usually do, we just put the braces on. I mean, we plan the case from the beginning, but as we go along, we adjust the braces. For Invisalign, once we're done, once we approve the case and they send us the boxes, like that, you know, once you have the boxes here, you cannot do any changes unless you take another impression of the patient and then you send it back to the company. So this is one of the difficulties with Invisalign, is that you need to plan it ahead of the time. So basically this is the advantage and the disadvantage, and I think future-wise, Invisalign, as it gets after some years with many improvement, there is a lot of improvement when it was they are utilizing the technology. We used to take PBS impression, polyvinyl siloxane impressions, and we send it to the States with UPS, and it takes about 2 weeks to send it to them. Nowadays, we don't take impressions anymore. What we do, when a patient comes, we take the photos and then we scan theirs with this steric scanner. After that, we send it right away. Once we scan it, we send it to Invisalign, and usually it takes about like a few hours and it's there. The problem with this scanner is that it takes time. It's about 25 minutes. There are different scanners, and they are fast, and they because that one is an old generation. There are different scanners which takes like 5 to 7 minutes nowadays. So this is basically about Invisalign or clear aligners. And I think as we go along with time, there will be a lot of improvement for Invisalign. Now, I'll just open for any questions. If anybody has a question, then I can answer right away. If no, then thank you all. Thank you all for watching. Thank you all for your interest, and thank you for Dentoscope. And we wish you all the best. And inshallah, we'll do another talk later on, maybe inshallah.